All right, good afternoon. As you know, some time ago, we had a press briefing pertaining to the shortages of drugs and medical supplies in the public health system. And at that point, we had just concluded um, doing an audit at the Materials Management Unit, which is located at Diamond. And we had discovered then that there were about $10 billion worth of expired medicines that were at the bond, and we had to subsequently dump that because it was not fit for human consumption. After that, we proceeded to do uh, an audit of all the regions to see whether or not we have expired medication and medical supplies, reagents, and so forth. And we have just concluded that audit, and I've just received um, the executive summary of that report. And I thought it's important that I share that. So, from that report, having concluded the audit in every one of the regions, we have been able to ascertain that in the 10 regions, we have had another $1.1 billion of expired medications, medical supplies, and laboratory and diagnostic supplies. So I thought you would want to know that. And these were all expired before we came into government. We also have been able to validate the stock that we have given to the different regions. And as of now, in the 10 different regions, we have pharmaceuticals worth 5.6 billion across the different regions. We have $877 million worth in medical supplies in the different regions, and we have laboratory and diagnostic supplies at $5 billion, which would approximate to current stock in the regions being about $11.5 billion. So while we have been able to validate what was expired in those regions, we have also been working very hard to replenish and to make sure that they have adequate medicines to continue doing their work. So I just thought that I'll mention that to you because I think that's an important follow-up. And we have the breakdown by the different regions, how much and what has expired and so forth. Uh, the other thing that I want to bring to your attention, I think as of yesterday, we would have achieved a milestone in terms of our vaccination program. And I thought it's important for us to highlight that. As of yesterday, persons who have received their first dose of the vaccine, we have had 150,694 persons who have received their first dose of their vaccines. This would equate to 31% of our population, 18 years and above, or 18 years and older, would have received this vaccine. In terms of second dose, we have had 6,037 persons who are now fully vaccinated. And another important thing to note is that, initially we had opened up vaccination to persons 60 years and above. And I'm quite pleased to say that for that age category, 60 years and above, we now have 61.3% of those persons being immunized. Of course, we still have a little bit more to do because we are aiming to get to about 85% or so. But I think being at 61.3%, that's a good place to be, and we'll continue to work. 40 to 59 years age group, we are at 28.6%. And for the 39 to 18 years age group, we are 20.9%. So in the younger age group, I think one of the myths that we've had is that younger people don't need to get vaccinated because perhaps they're getting a milder form of the disease. But I want to dispel that because we are now seeing in the hospitals and so forth, our hospitalization, that we are seeing younger patients coming in and to get treatment. And in the ICU, unfortunately, from the ICU, we have seen more severe cases of people in the ages between 40 and 50. And we have had, unfortunately, we've had a number of deaths in this age group as well. So we know with vaccination that it would help to prevent deaths, and it also helps to prevent the more severe form of the disease. So again, we want to make another appeal to persons that come out and get your vaccination because this really would help protect you from being hospitalized or being, you know, the reason why you die. So this can genuinely protect you from dying from COVID. So I'll stop there and perhaps you might have some questions.
Circling back to the drug, the expired drugs, what would have been other findings that you thought that would have caused that?
Well, I think one of the things that, if you recall, the system that you had in place then was that some of these medications were being bought by the regions themselves. We have changed that system, so now we are doing more centralized procurement, where monies that were sent to the regions are sent back to the ministry so that we can do one big purchase. In that way, you will get more drugs for less cost because you're buying in bulk. And I think that's the advantage of now changing back the system to what it was. Um, the reasons why we ended up having expired medication can be varied because one of the things that we notice is that medication that doctors are prescribing are not necessarily the ones that they have in stock. So if you're buying things that the doctors are not using, obviously these things are going to be left back. And the other one is that I understand that in 2017 that the ministry actually ordered the same thing twice. And so because of that, um, you had at that point in time lots of stuff that nobody was using. And that created a problem. One of the obvious things is that if you knew that was the case, then perhaps you could have curtailed those orders, stopped the orders, but that duplication was there, and they ended up having surplus of many of the medications. And unfortunately, they had short dates, and that's why you have expiry. So it is a problem. Um, we have, um, I mean, now it's about $11 billion worth of expired medication. That's a lot of money. So, you know, we'll now have to use this information to see whether we can hold anybody culpable for this because it's certainly a lot of money. And that's one of the other things that we'll be looking into.
Um, Melissa, was there any case cited where the drugs were received expired?
That's a very good question. And I'll have to get the people who audited the, the various areas to see whether or not, and to specifically answer that question. Because we have heard rumors about things like that, but I don't want to venture there. I'll prefer for me to get a report, and then I'll be able to talk from that report.
Going back to the vaccination, you said we met a milestone. There's concern worldwide about shortage of vaccines and so on.
Mhm.
Do we have any concerns about not being able to procure vaccines because of these shortages worldwide?
Scarcity of vaccines is a big problem, and we have worked on multiple levels to try to assure that we get vaccines into Guyana. So we have been working with COVAX, that's the global procurement mechanism for vaccines. COVAX promised to get to Guyana for 20% of our population. We have received from them so far 24,000 doses. We are expecting another shipment from COVAX sometime during this month. We are trying to get ETA to know exactly when, but we are expecting another 38,000 doses from COVAX. In addition to that 38,000 doses, we are expecting that in the next month or so that they will fulfill the obligation of that 20%. So that's one source of our vaccines. You know that we've also gotten these bilaterals through China and India and those donations. So that's another source of vaccines. We have also gone ahead and purchased vaccines, and this would be the Sputnik V. And so we have made those purchases, and those orders have been coming in tranches. So right now, the backbone of our program has been using the Sputnik V. One of the challenges that you do have when you're using a vaccine like Sputnik V is that it's -18 to -20. And therefore, it creates a lot of logistical problems for us. Keeping these vaccines cold, getting it out to some of the most remote areas. Nevertheless, we have been so far working and doing that. And we have been using up a lot of dry ice because we got to get dry ice to make sure that it's kept at the refrigerated temperature. So we have enough vaccines on order and those that are right now in country. And we feel assured that we would be able to give to every single Guyanese adult a vaccine. And so that's what we've been working on. What we want to do now is to make sure that people come forward and get their vaccine. So vaccine for us is not the issue. It is making sure that people come and get their vaccine. And that's a good place to be. Unfortunately, we have seen in some communities there have been vaccine hesitancy, and because of all kinds of myths. And that's one of the areas that we really need some help to dispel those myths so that people can come forward and get their vaccines.
If I can have a follow-up
Sure.
to this. Initially, with all of the tranches of vaccines that we have received,
Mhm.
when they're all put together and we break them down evenly,
Mhm.
it comes up to everyone. It comes up to us being able to vaccinate 130,000 persons.
Mhm.
But you had also mentioned that there are two different sets of vaccines as it relates to Sputnik.
Mhm.
Can you give us a breakdown of how many first doses of Sputnik was ordered and how many second doses were ordered?
So we have ordered for Sputnik, we've actually ordered for 400,000 people, right? And with that 400,000 persons, we are actually going to get 400,000 first doses and 400,000 of the second doses. So that's what we have ordered. Now that's coming in batches. So as we get them, we are vaccinating, and that's what we've been doing.
If I can take you back to the expired drugs, what are how are some of the regions dealing with current drugs?
So we have been replenishing the drugs that the regions would like to have, and we have not stabilized the situation. Not everything that the regions want they can get right now. There's still a few drugs that would be short, and as we get those cribs coming into the ministry to the MMU, we are trying to manage that. Earlier in the year, we did do a 4 months emergency procurement, and the orders for that is now coming in. So as fast as we get them, we are not keeping it centrally. We are sending it out to the regions. We have just maybe about 2 weeks ago, you would have seen in the newspaper the closing of another tender for 10 months, and that would be awarded shortly. Um, so once it's evaluated and awarded, we'll then have medicines for the next 10 months. So we're working very quickly to try to stabilize the situation, but I do recognize that there are items that would be short, but generally we have across the board, we have, I would say, more than 80% of what they require, 85% of what they require would be out in those regions. And we're working to get the other percentages, get everything that they need. That we anticipate maybe in another 2 months, 3 months from now, we should be able to do that.
Thank you. If I can get one final question. Has there been any solution? We spoke earlier about the issue where doctors were prescribing medication that weren't necessarily those in stock.
Mm-hmm.
So that means they're buying what isn't really needed for
Mhm.
what is common in the
Mhm.
areas. Has there been anything by the ministry to address that so as to not
Well, there's a couple ways that we have been working to address that. First of all, you have to get a list, um, an updated list of what is being used for the different types of diseases. And as you update that list, that is what is going to be your reference or your baseline to buy these medicines. So we have been working on
so they
that
were
list.
using an outdated list?
I don't know what they were using. But obviously, there were medications that um, nobody prescribed, and so a good example of that. Let's say somebody with high blood pressure, you would have different groups of medicines that you can use, right? And those things change. The way that you prescribe would change over time because there are new guidelines, and if you're buying using something that is outdated and you're not buying in accordance with new guidelines, let's say, then you'll find that the doctors would be working with guidelines and and the procurement people are working with the old meds, right? So you have meds, but nobody is prescribing them, and therefore the patients are not going to get them. So we are working to align those things. We have formed within the ministry a therapeutic committee. That committee is going to be responsible for all these different meds that you have, align them with, the most recent guidelines, and to make sure that when the procurement guys go out to order, that they're ordering based on these new guidelines. And also, what happens then is that you also have to um, constantly update this guideline. So at least annually you have to update it. And outside of those guidelines, outside of that big list, there would also be specialized medication that you would need. So for example, someone who's, need a special type of cancer drug. It might not be on your regular list, but we have to get like a supplementary list for this specialized group of patients. So cancer patients and other specialized areas so that we can make sure that those patients too are taken care of, right? Cancer, we have people like, you have a few persons who had transplants. They require special medication to make sure that their body don't reject these transplants. So there are things like that. So there are more specialized medication that goes on a supplementary list, and we have to make sure that we get those as well.
Last question, Minister. When would the auditor submit the full report?
I'm hoping that by sometime next week we'll get a full report, and then we'll be able to go through all the details.
Thank you. Minister, we have reports that 5 schools in Region 6
Mhm.
have closed because of COVID-19. Have you received such reports?
I don't know the specificity with schools, but definitely in Region 6, we have seen a number of cases in Region 6. And that's something that we are monitoring because in New Amsterdam, we have seen a number of cases in the New Amsterdam area. But today, over the last 24 hours, we would have had about 123 new cases of COVID across the country. And that's something that we have to constantly monitor, identify where those persons are, and to make sure that they are isolated. Most of the cases that we've had so far are mild, but we do have, I think, 60 something persons who were hospitalized, 56 at Ocean View, 16 in the ICU. So it is something that we have to keep an eye on. But I can't give you the specifics with these students. I don't have that information at this point in time.
Okay, thank you.
All right.